and good afternoon. It is Friday and it is time for our Lunch and Learn. Now, today we're going to talk about mold toxicity. And you may think that you have a mold problem only if you can see a mold problem, but I'm here to tell you that you may have a mold problem and you are totally unaware. And we're going to talk about some of the health challenges that can happen if you do have a mold problem. So it goes without saying that if you live in the Gulf Coast region, which we do, we kind of live in the swamp. Not that the ground itself is swampy, but the air is full of humidity. I mean, the days where we have under 50% humidity is very rare indeed. Many days we've got 80% or higher of humidity, and you walk outside and it is just miserable because you have all that moisture in the air. Now, when I used to live in England, I remember a friend came over to spend some time in Louisiana. And when she came back, I asked her, I said, well, so what did you think? She came in the summer, and I asked her, what did she think about the climate and that kind of thing? Because England is not known for its warmth, certainly where we lived in the Bradford area. And she had the most astonishing thing to say. She said the air was so sensual and sultry. And I thought, oh my, I've never heard anybody describe it in that way. However, that is probably a good description. It is very wet. It is very moist. And what that means is it causes mold. It's a good environment for mold to sprout, for mold to be in the atmosphere. And so you're breathing it. It's on your clothes. You bring it into your house and those kind of things. So back in the day, we made our housing materials, out of natural materials. There were weep holes, there were all kinds of things that let the house air out. And it was a little bit better for us as far as toxicity. Now we have all of these chemicals that we put in the building process. There are all kinds of layers of plastic to keep things from deteriorating and that kind of thing. And so while that is good on the builder side, it's not so good on the human side because it traps moisture in the building, and we don't want to have moisture in the building. When you have moisture in the building, then you have all kinds of problems. Bathrooms, sinks, kitchens are always wet. We happen to live in a very old house, and one of the sinks, our sink that's in the it's in the hall. It's not even in a bedroom. It's in a hall, the half bath. And it has a little pretty Victorian style sink. Well, it's old and the tap doesn't turn off all that well. And so when we have guests, they don't turn the water off. And so we have a lot of water wasted. So we've taken care to remedy that. I have a friend who also lives in our area. Now, her house is not that old. However, she noticed that in her bathroom counter, the counter seemed to be swelling and splitting. And she was looking all around and there was no water damage that she could see. However, she had inspectors come out and they found a very, very tiny leak in the attic that was running down the pipes into that bathroom. So she's having to pull out the cabinet. She's having to redo the flooring. They're having to do mold remediation because of this tiny leak that's probably been there for years. She didn't know about it. There was no kind of evidence that it was there. I'm telling you that most of us at one time or another have lived in a home that had mold in it, and it's very deleterious for our health. So typical toxic bacteria includes mycobacteria and gram-negative species, okay? Mold spores release toxin-containing spores into the environment to kill off other organisms, thereby securing their need to spread. So it kills off all of their predators, okay? And so they proliferate and multiply in our environment. Common ones are Penicillium, Aspergillus, and there's some other ones, and I'm not even going to try and say that. It doesn't really matter. What matters is that these Mold spores are in our clothes, they're in our carpets, they're in our furniture, they're in the walls. And so this is a real problem. This article is written by a medical doctor. Her name is Dr. Ann Carlson, and she is a medical doctor. She earned her degree from the Perelman School of Medicine in the University of Philadelphia in 1982. And so she writes extensively, and her practice deals extensively with chronic diseases caused by mold. So we're hearing all the evidence from an expert, and so I hope you're going to enjoy this. When the bacteria is growing in your home, what you're going to find is you're going to have some lung issues, some asthma, you can have some cysts in your lungs. You are inhaling the bacteria and the endotoxins. The symptoms include fever, aches and pains, headaches, coughs, shortness of breath, chest tightness, airway inflammation, nose and throat irritation, and nausea. Now, I'm just going to tell you, in my world, when people come in to see me, that list of symptoms is pretty much what I hear every day. So if you are dealing with tiredness and muscle aches and frequent headaches, tightness in the chest, then you may need to look a little bit deeper for mold in your home. If you were affected by Harvey, if you were affected by any of the high water events that we've had in our area in the past 10 years, you probably do have mold in your home. You're going to have experts in mold remediation come out and do the testing and see what's in your home. Mold is deadly. Black mold is very deadly. And black mold you can see, but some of the mold you cannot see. We have in our area, well, pretty much all over the world, is something called sick building syndrome. And that is where you've got synthetic textiles, we'll say textiles for lack of a better word, could be flooring, could be paint, could be carpet, that is made with formaldehyde and different other chemicals, and they off-gas into the environment. And when they do that, that off-gassing causes us to be sick. I used to teach in an old church, and the school where I taught, or the building where I taught, was a metal building. I taught on the top floor. I would go into the building and I would be fine. By the end of the day, I had a screaming headache, and I'm pretty sure that was a toxic building. And in the summer, I did not have headaches. So that was another indication that pointed me to the toxicity in the building. I know a young man, very healthy, spends a lot of time at the gym. He was working at a oil and gas place, and they got a new building. They imported a lot of their materials from outside of the United States. And as he started working in this building, he became very, very sick. Not sick with a fever and that kind of thing, but like Chinese food would cause him to get hives. When he would drink a Gatorade, that would cause him to almost go into anaphylaxis. It wasn't like life and death, but he could feel the tightness in his chest and absolutely red all over his chest and that kind of thing. And what was it? It was an allergic reaction to things that he had had all his life. And it was connected to the new building. Once he moved out of that building, all those symptoms just went away. So it's really, really important that if you're having any of these symptoms, you want to see if it is part of the sick building syndrome. A full 25% of humans in the world, so this is world population, 25%, has a genetic predisposition to develop chronic illness when exposed to indoor toxic molds. All right, so these molds grow in water-damaged buildings. So 1/4 of the world's population is predisposed to develop chronic illness. These illnesses can manifest as flu-like symptoms, nasal congestion, sinusitis, pharyngitis, bronchitis, asthma, pneumonia, fatigue, brain fog, focus and concentration problems, memory abnormalities, all right, emotional irritability. I mean, come on, do we not see that all over the place? Emotional irritability, paranoia, anger, rage, hormone dysfunction, gastrointestinal distress, leaky gut syndrome, inadequate digestive function, peripheral vascular disease, autoimmune disease, muscle pain, weakness, aerobic exercise intolerance, and so much more. So, oh my gosh, all of those symptoms I see every day in the clinic. Remember, we have this wonderful scan. This is a biophotonic scanner, and you take the heel of your hand and you just put it, whoop, there you go, put it on that laser right there. And that tells us in 30 seconds what your digestion is doing. So if you have leaky gut, if you have nutritional deficits, if you are not absorbing the food that you're eating, you're probably not absorbing the supplements that you are taking as well. So this is a 30-second test that gives us a good deal of information on what's going on in your gut. One of the things that I know is that if I can get your gut and your brain reconnected, I can get you well. Now, why is that? That is because the gut houses your second brain. You've got a brain in your head, of course, but you also have another brain in the gut. If the gut and the brain are not connected, or if there's some dysfunction in the gut because you've not been eating properly, you've got toxicity in the gut, you've got candida, mold, mycotoxins, all those kind of things in the gut, and everybody does to a certain degree. Everybody has parasites to a certain degree. The higher of the degree that you have them, the more compromised your gut is going to be. And so what we want to do as a primary foundational technique is to get that gut integrity restored, because as we do that, then your immune system is going to function so much better. And when your immune system is functioning the way it needs to, your internal environment is not going to be a place where these bugs are going to be happy. So you don't want to be a host for parasites. I don't, you don't, we don't want to be a host for mold. We probably are going to put in the comments a spit test. Now, why do I want you to do a spit test? Because if you spit in the morning, first thing in the morning, in a glass of water, and you get a lot of strings hanging down from the saliva, that is indicative that you have toxic mold in your body. So this is a really, really good test. It's a free test that you can do to see what your body composition is as far as mold. How many of us are having brain fog? How many of us are having senior moments and we think it's just because we're older? I don't think age has anything to do with it, except that we have been exposed longer and we've reached critical mass as regards to the mold toxicity. So short-term exposure is associated with many of those diseases that I just listed, that I just talked about. But chronic inflammation is going to be a more serious disease like chronic fatigue syndrome, fibromyalgia, Sjogren's, all those autoimmune things. It's going to be much more liable to go that way because the central nervous system's control of the neuroimmune and neuroendocrine system is damaged, with the result deficiencies in crucial central regulatory hormones. Okay, so this is really important. The entire hypothalamic, pituitary, adrenal axis and the thyroid gland can be affected. This is for all of us out there who have undiagnosed thyroid issues, which is 80% of the female population in the United States. So chances are likely that this affects you. It also affects aberrations in the leptin mechanism of the body. So what does that mean? That means we don't get the signal that we are full and to stop eating. So these mycotoxins can cause us to be overeating. Now, part of that is because fungus, mold, yeast, all that kind of stuff require sugar to live. And so part of their survival technique is to cut off the leptin signaling molecules so that we will eat and eat and eat, and we crave all of the bad things, all of the things that turn to sugar, like alcohol, pasta, bread, candy, pie, all that kind of thing, because that feeds the beast. We don't want to do that, okay? So when that happens, then we're going to be more predisposed to be diabetic. So we don't want that to happen. It actually also affects the body's metabolism of fats. Now, fats are very important to us because our brain runs on fats. Our brain runs on cholesterol. Your liver manufactures cholesterol. Every cell in your body needs cholesterol. And so if you have had a gallbladder removal, then you're not metabolizing fats, you're wearing your fat. And so that is a big deal with brain fog and all that kind of thing. So energy metabolism needs fat metabolism, and the mold squashes that as well, okay? Salt and water balance, protein balance, carbohydrates, all of that in the blood is affected by the mycotoxins that we are ingesting or that we are living with, okay? The immune system is confused, all right? Dysfunction results in chronic polymicrobial infections, okay? Chronic, my light's going to go off in a minute because my seeing eye does not see me. So I'm going to be there we go. I'm going to be in the dark for a minute. Polymicrobial infections, that means many, many microbes. And so what we want to do is we want to guard against that. How can we do that? All right, this is written by a medical doctor, and she says in order for you to rid yourself of all of these things, you're going to have a lot of medical tests to kind of drill down and see what you're doing. Now, what we do here in the clinic, we do vibratory frequencies. And so in my world, I don't care what it's called. What I care is, do you have extra vibrational frequencies that we need to eradicate? And when we do, then health returns. And so we want to make sure that that happens. So actually, how does this work? Well, the toxins from the mold come into your home. All right. They release spores, which is a portion of their cell wall fragment or any of the other microparticles, and they contaminate the walls, the furniture, the flooring, all that kind of thing, okay? They release gases that actively cause mold to grow. Now, these are things that you're not going to perceive unless you are super, super sensitive. My husband went into, right before we got married, we were looking for some particular earrings for me to wear on our wedding day. And we went into this bridal store that was right next to a dry cleaner store. The toxicity in that building was so bad that my husband could not stay in that building. When he left that building, within 15 minutes, his eye had swelled, protruding out of his face because of the toxicity of whatever was going on in that building. And I told him, we are never going back in that building because your eyesight is just too precious, all right? Variability of all of these diseases are influenced by the individual's prior lifetime exposure as well as other comorbidities. Patients who have had prior mold exposure will react more strongly to new exposure. The inflammatory innate immune response can occur even at mold levels that might be considered within normal limits on air quality testing or levels that might not affect other people. So we want to be very careful not to judge other people by what we ourselves experience. So I can go somewhere, I'm not going to have any reactivity, but someone else, as in the case of the bridal store, I had no reactivity at all. My poor husband, he had a huge reaction. And so we want to be very, very careful, and we want to validate. If people say they're allergic, then we want to validate that and say, well, these are the things that you need to do to get that resolved. All right. So a lot of people think that sick building syndrome is just mold related. However, there's a different branch of the immune system that is not involved with true IgE medicated allergic reactivity. So this is something that your doctor is going to look at, and he might look at your IgE and say, oh yeah, you're fine. Not so, because there's another arm that the mold affects that's not going to show up on your blood work. She says the adverse inflammatory response occurs as quickly as anaphylaxis type reactions when sensitized individuals are exposed to mold. The patient's immune systems don't recognize the mycotoxins given off in the molds and the water damaged buildings as foreign things to be eliminated from the body. The innate immune system, that's what you're born with. Activation occurs, but the cellular branch of the immune system does not get adequate messaging to start making antibodies to bind and eliminate those molds and toxins. These small mycotoxins, which affect they are both fat and water soluble and thus can enter into every cell in the body. This is important. They migrate to the nuclei, turn on the cell's production of inflammatory cytokines. Where have we heard that before? Acting as epigenetic modifiers that alter how the cell's genetic material is transcribed. That means that we can have genes shut off, we can have genes turn on, and that's not something any of us want to. So a deep chronic infection and dysregulation of the immune system in these patients requires a complete medical workup. All right. Many will be suffering from leaky gut with markedly abnormal gastrointestinal microbes, poor digestive function, and nutritional deficits. And this is what we see when we do that 30-second scan. I will just tell you, in the last 2 weeks, we've had 4, 5, maybe even 6 people that have come in with a diagnosis from their medical doctor of SIBO. SIBO is SIBO, small intestine bacterial overgrowth. That means that the good bacteria that we're supposed to have that keep us alive, that help us to win, okay, in life, it is overshadowed by the bad bacteria. It can be mold as well. And so what we want to do when we're seeing those diagnoses, and normally, I mean, we know what SIBO is, we see it occasionally, but I am seeing it, like I say, we've had multiple cases in the last 2 weeks diagnosed by their medical doctors. So what does that look like? That looks like a lot of gas, a lot of belching, a lot of bloating, primarily uncontrollable belching. So if that's you, then you need to come and see us because we've got some real help for that. All right. This is occurring because of inadequate liver detoxification pathways, damaged mitochondrial energy production, abnormalities of coagulation, and chronic vector-borne and community-acquired infections. Laboratory testing to eradicate comorbidities help to guide the treatment. Both inflammatory markers in the blood and mycotoxins measurable in the urine provide guidelines to treating this with the medical doctors. Now, I have never, but maybe once, seen a urine sample from the doctor, the lab work that checked for bacteria, mycotoxins in the urine. Usually they don't. Usually they just say, yes, we've got bacteria, or no, we have no bacteria. That's usually what we see. I think in all the years that I've been doing this, and I've been doing this since 2004, I think that we've only ever seen one person that came in with a lab report that showed what specific toxins are in the urine. All right. She says most doctors have little understanding and no training in recognition, evaluation, management of patients suffering from mold illnesses. All right. She says that is better, that has gotten better over the last 15 years. And so we know that we have hope for that. You can get toxicity in your vehicle. You can get toxicity in your home. You can have toxicity in your workplace. So pay attention to your body. If you walk into a room and you start coughing really, really badly, then you're probably being exposed to something that you don't see, and you need to make sure that you're taking care of that. So what happens if you have this in your home? You cannot fix this by yourself. You're just not qualified. You don't have the right equipment, and it's just too hard. So you want to reach out to someone who is certified in mold remediation. They will come in, they have the right hazmat, they will repair what needs to be repaired, they will hose down all of your walls, your carpets, your ceilings, everything. They'll vacuum it up and they'll spray fungicide, mold retardants on there. Then they'll vacuum again. They'll do all the hard work for you. Is it messy? Yes. Is it expensive? Yes. But how expensive is a chronic disease if you're living with a chronic disease? That is very, 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 very expensive. And so I would rather, if I'm having those symptoms, fortunately, we're not having those symptoms, okay? We want to make sure that if we're having those symptoms that we get our home checked out, especially if we have been flooded. As I said, we live in the swamp as far as the air quality is concerned. And on my computer every day, I'll get a notification of we've got poor air quality out there and we've got 85% humidity out there. And so you just have to pay attention to what we're already being told. All right. So as I said, they'll bring in special equipment. All right. Anything that's non-porous in your house, like dishes, utensils, pots, pans, metal, glass, porcelain, stone objects, those can be wiped down with a moldicide. Simple household cleaners such as borax, bleach, and vinegar can be useful. Porous material like bedding, furniture, clothing may not be able to be salvaged. How many of us have gone up and down the street on trash day and have seen mattresses that are outside waiting to be picked up that are full of mold? I've seen that multiple times. So these mycotoxins are really, really dangerous, and they can lead to cancer. So this is something that we want to understand. Chronic toxicity results from low dose exposure over prolonged periods of time, leads to cancer, liver failure, kidney failure, chronic fatigue, and neuropsychiatric symptoms that are often attributed to other causes. They inhibit protein synthesis, which interferes with growth and body repair, and they hamper the immune system, which causes cancer to be able to proliferate. All right. You can get rashes, skin diseases, asthma. All of this is due to the metabolic processes from molds. Okay. So we want to make sure that we don't have this in our life, because it also can produce birth defects in our children. So aflatoxins are the primary mold family. Aflatoxins are found on peanuts. So if you eat peanuts a lot, if you eat peanut butter a lot, you may be ingesting aflatoxins. We don't recommend that. I try and stay away from peanuts and peanut butter because of the aflatoxins. I don't want to have any mold in my body. Hepatitis B with aflatoxins is almost always associated with liver cancer. How much liver cancer are we seeing these days? We're seeing a lot. So I've given you a lot of information. Franklin says, does the prostate make a male cause problems in the bladder? Well, if the prostate is inflamed, the prostate wraps around the ureter and it squeezes the ureter. So a male will have trouble emptying his bladder, slow start, slow stop. So yes, prostate cancer can cause that, but benign prostate enlargement, BPH, hypertrophy enlargement, those also will cause bladder problems in males. So if you're over a certain age, like 50, I think they start testing for that. And moles can affect every part in the body. So it's not, I don't have that in my research that I just read to you today, However, that's something very much worth looking into. We know that there are a lot of bacteria, there are parasites and that kind of thing that affect the prostate, and it leads to all kinds of problems. So we don't want that. I appreciate you guys chiming in. I appreciate the hellos. Hello. I appreciate you giving me your time. Hopefully, you found this enlightening. Hopefully, you're going to check yourself out, check your home out, be aware of any kind of mold that you may have in your home, and do what you need to do. Call the remediation specialist. Get that taken care of because your health is very, very important. It is the weekend. Enjoy yourself, take some time off, visit with your family, do all the good things, and happy Father's Day to all of the fathers out there. I know I'm going to be spending time with mine, and I can't wait. So you guys enjoy yourself and take care. Remember, I love you, and I'll see you next week.